Men are quitting the workforce and nobody knows why. Since the 1950s, the number of prime-aged men, that is men between the ages of 25 and 54, that are participating in the workforce has steadily declined. This has persisted through times of recession, through times of economic growth, and everything in between. And today in America, they're missing around 5 million of these men from the workforce. These guys are not counted in unemployment statistics because unemployment statistics only count people who are actively seeking work. There's also a problem globally. Around 1 in 5 young people around the world are NEETs, so they're not in education, employment, or training. And what's arguably more interesting is that if you look at the older people, their participation in the workforce has actually steadily increased over the last few decades. Over the last few decades, the number of men aged 60 to 64 who are in the workforce has increased by over 20 percentage points. You would expect these younger men to be healthier and better educated, and therefore be more willing to work. So where have these guys gone, and what does it tell us about the future and the present of work today? Well, there are some theories and we'll try and cover them. Let's try and find out. Other outlets have tried to write about this to varying degrees of success, in my opinion. Fortune magazine wrote a piece about these young men becoming NEETs, not in education, employment, or training. And notably, they didn't actually interview any NEETs, but they did interview people who worked in HR. And this was the explanation that they had to give for why so many young men were dropping out of the workforce. They want the dream job title, the perfect culture fit, and a supreme compensation package right out of the gate, he explains. Instead of being open to decent opportunities as stepping stones, a lot of them would rather ride the unemployment wave while holding out for that unicorn role. Personally, this explanation is kind of bullshit in my opinion. It's not that good of an explanation, and it doesn't even come close to explaining why this might be a trend that has lasted through several decades, through times of economic growth when opportunities were relatively abundant, and through times of recession when they are less abundant. This is very like avocado toast coded. They did not cook with this one. As I say, I think we can do a lot better. And we can do one thing that wasn't really done in this article, which is to investigate what the answers are when you actually just ask these young guys directly why they aren't working. That can be extremely enlightening. So what are the answers that you get when you actually just ask young people directly why they're choosing not to participate in the labour force? If we exclude students from the equation, the biggest reason for prime-age women is taking care of home responsibilities, which might not be that surprising. When we ask men why they aren't working, on the other hand, the number one reason comes out to be illness or disability. Even in the UK, you see that the people who aren't participating in the workforce largely report sickness as their main reason for being economically inactive. So what's happened? Have men just suddenly gotten really sick over the last 50 years? Are they faking it? Well, probably not faking it, because these men are subjectively at least reporting being less happy, more sad, and more stressed, even than unemployed men who are seeking work. Most of these guys, I would say, are legitimately unwell, but maybe not in the ways that you might necessarily expect at first glance. Nearly half of prime-age men who are not in the labour force take pain medication on any given day. And of those guys, around 2/3 actually take prescription pain medication every day. I've talked briefly about the opioid epidemic and its effects, but they are super wide-ranging. Since 1999, the number of men who report feeling pain has stayed constant, while the number of prescription opioids has tripled. The men who have dropped out of the workforce seem to be concentrated in areas that have really suffered from the opioid crisis. Labour force participation has fallen even more in US counties where more opioid pain medication is prescribed. However, these guys are surviving somehow, right? Because you can't survive without any money. Almost half of these people are on some form of disability insurance or some form of disability payment. And disability payments don't just cover physical ailments, but also mental health conditions. And around 1/3 of all disability payouts in the US, at least, go to people with some kind of mental health condition, whether that's a depressive condition, a psychotic disorder, or any other kind of mental disorder. A good chunk of these people are inactive, not because of necessarily just physical ailments, but because of mental health as well. You know, a little bit somber, but in the UK, suicide is actually the biggest killer of men under 50. Globally, men make up around 3/4 of all suicides. And mental health is like an important component to this. I think you can't ignore it. And therefore, it's not that surprising that people who choose to not participate in the workforce report really low levels of emotional well-being and very little meaning from their daily activities. They're not quitting the workforce in order to be like freeloaders and to, live off the government purse. Rather, they're clearly unhappy in this state. Praise the Sun says, doesn't that mean they live in poverty? Yeah, they live in effective poverty because disability payments are not that great. However, I think it's impossible to talk about this without also talking about the experience of those people who have chosen to actively seek work and have found that the experience has been getting steadily worse and worse. We have phenomenons like job listings for positions that are just non-existent, and the overall level of competition has gotten harder and harder. Interview requirements are getting more strict. Employment criteria is getting more strict. And that can definitely have an effect in making people feel just like disillusioned with the workforce more broadly. Many of them actually report that the lack of skills is the biggest barrier for them getting back into work on top of their illness or disability. Because once a person has been out of the workforce for any significant amount of time, it can feel like the skills gap simply widens every year, and it can make it more and more difficult for them to re-enter the workforce. The opportunities that they need, the entry-level jobs that they need, have effectively vanished and been replaced with jobs that require significant level of self-training. That's what's considered an entry-level job now. They basically don't have the skills to be able to re-enter the workforce because the jobs that would take people who wanted to re-enter, the entry-level jobs, have slowly been disappearing. You know, you need like experience to get a job, but you need a job to get experience. And if you tap out of the workforce, you can rapidly end up in a situation where you can't get back into work. And even if you can, those jobs might not be able to offer you the support, the insurance, or the pay to be able to compensate for whatever disability you may also have. So the jobs that are available are just a complete mismatch for what people actually need. The jobs that are available wouldn't incentivize them to return to work. They don't pay enough. They don't provide the right health provisions. Jobs that would match up with these people have disappeared. So you might wonder, like, right, bad mental and physical health are driving them out of the workforce. And, you know, the geography of the opioid epidemic has driven people out of the workforce as well as disability. But why is this trend flipped for older people then? Why are older people participating more and more in the workforce today than any time in the last few decades, despite the fact that they are more likely to be not fit to work more broadly, right? And, well, people smarter than me have also asked that same question. There's a big research project called the International Social Security Project, and the whole deal of these guys is to investigate different pension plans, state pension plans across the world, and figure out how that's been affecting people's decision to work. And basically, these older people are working because they have no choice. So these guys looked at 12 different countries, and up until the mid-90s, the number of older men in the workforce was steadily decreasing. These people were choosing to retire, and they were able to retire. But since the 90s, the trend has been consistently upwards in this U-shape across wealthy nations. Well, these people are not working necessarily because they want to, but rather because they have to. In the study of 12 countries, they found that 9 countries raised the earliest age at which you can retire. And another 9 countries lowered the generosity of the benefits. But even when the raises came, they were typically harder to access because one had to wait longer to be able to access them. A unique case goes on when you look at the US though, because the US hasn't actually had a major pension reform since the 80s. And yet they've still seen this same trend of older people spending more and more time in the workforce. Despite the fact that they haven't seen a pension reform, they have actually seen other kinds of reform, specifically to disability and unemployment insurance, which have gotten harder and harder to access. And these are obviously huge lifelines for elderly people. The US's decision to make disability and unemployment insurance more and more difficult to access has potentially begun to reverse the trend in younger men as well. Because if we look at the post-COVID information, you can see that since the big dip in the pandemic, the number of men who are participating in the labour force has slowly started to increase. It's currently back to around like 2008 levels, which is still way, way below what it was in, the 90s and the early 2000s and any time before that. But American men are getting back to work. And this sounds like a good thing, right? It means that these people who were formerly NEETs are now actually like getting outside and socializing. But when you look at the numbers in terms of the disability statistics, I start to question how good of a thing this actually is. Because in the last 10 years, the number of men in the US on disability has dropped from 4.6 million to 3.7 million. Basically, 900,000 people are no longer claiming disability. And I'll let you decide if you think that 900,000 Americans have gotten suddenly healthier over the last decade. I don't know. Labour force participation rates are increasing and disability insurance claimants are decreasing. But there's not much evidence to suggest that this is a result of people actually getting healthier. And rather, it seems to me to at least imply that it's a result of these benefits being simply more difficult to access. At least that's my speculation. So American men are getting back to work, but I don't know if this is necessarily a good thing. Like this issue here, this issue of men leaving the labor force is, I think, a stark reminder of the state of both physical and mental health in, the modern world today. But it's also, I believe, a signal of broader trends, of broader societal attitudes towards work more generally. Because there is a decent chunk of people who are healthy and still choosing to exit the workforce. These people are called in and outs and are willingly taking extended breaks from jobs in order to basically live off their savings and be able to actually have some breaks. I think particularly in the US, there's been a big shift away from finding identity through work. And this is something that has persisted across income levels. People who work long hours and earn high pay are starting to show similar patterns. And they are actually massively reducing their hours. And I think this is likely a holdover from the pandemic, when people realized that they could find a lot of joy in their life through things that weren't work. There is clearly a huge problem with physical and mental health. But if I had to give you like a little bit of optimism, it's that there appears to be a big shift away from trying to find identity through work. However, I don't know how much of this recent increase in labor force participation is something to be like celebrated, because unless this increase has come with an increase in physical health, an increase in mental health, and a reduction in opioid prescriptions, amongst a bunch of other things, then it seems to be a signal that those men are being effectively forced to go back to work, rather than being in appropriate physical and mental condition to actually maintain a job for the long term.